And what a go. Welcome to Cafe Lockdown. Who we got here?
I'm Angela Clarke.
Now, Angela, what did you used to do?
I was a registered nurse for 24 years, and 23 and a half years I spent looking after people with kidney failure, end-stage kidney failure.
Okay, so that's really interesting because we've been interviewing people who want kidney transplants. They can't get on the transplant unless they have 5 vaccinations.
That's just ridiculous. I find that I chatted to Tamara. I saw a comment on one of the feeds, and I just thought she needs help. She needs support. I can't get my head around where's the evidence. You know, I'm from the genre that we were taught evidence-based nursing, evidence-based practice, and yet that's just all slid out the window. And when you look after people with kidney failure, one thing that happens is when there's a new medication that comes out, you know, a lot of our patients don't go on that medication for quite some time until some team in Australia or some doctors will go, well, it's working with this group of people. Because when you look at the exclusion criteria for research, a part of that will always be kidney failure, because how do you know if they're reacting to the drug or their kidneys aren't processing? So they might have different levels or different responses or different, they call it half-lives, how long a drug is active in somebody's system. So even the fact that they're suggesting that transplant patients have this new medication that it hasn't gone through formal trial, it's in trial. How can you, it's mind-blowing. I can't get my head around it. And I've really struggled with this journey. I struggle not being a nurse every day. I was a patient advocate.
You miss it?
Oh, every day. Yes, I'm currently working in a cafe, which will remain nameless. They luckily gave me a job when I've been unemployed and I needed some money and income, but I miss nursing, yeah. And it's interesting because you hear the stories of how bad it is, and I met nurses that got the first round to keep their mortgages, keep a roof over their head, but a lot of them have not gone back for their boosters. A lot of them are bailing.
Are they forcing them to take the third one if they want to keep their job? Yes,
they are, yes. Interestingly, it's coming down now to the managers. The government have mandated, or the New South Wales Health have mandated a booster for the nurses. I keep bumping into ex-colleagues of mine who got the first 2, and they're dodging it. I bumped into a nurse actually at the cafe, and I was listening to her stories, and she originally worked in accident emergency, and she was even telling their friend, obviously helping wake their friend up, that the stories and the excuses that the medical profession are coming up with to explain these side effects and these vaccine injuries, and she's just unbelievable.
Like what? Can you give an example?
Well, she didn't actually tell me. I'm cleaning a table, and I just turned around, and generally I'm like, I don't talk about it at work, but I said, well, I'm an ex-nurse. I worked at the base in the renal unit, you know. So she went, oh, and she was quite impressed that I made a stand, but I don't think enough of us did.
No.
Because I think if we'd made a stand,
they'd back off.
We wouldn't be here. And interestingly, I still believe this is the case. I could be wrong, but I'm pretty sure the government in Victoria stopped the booster for the ambulance officers because they said, no, we're out.
Oh, wow.
And I'm
kept that quiet.
Yes. I just heard a little tweaking of it, and I probably need to do a bit of a Google search and see if it's true. So it's ironic that they've pulled back. All of the mandates have been canned, but then New South Wales Health is pressing on. Ironically, this nurse said her manager was really helping her hide underneath the radar, and because obviously they're short-staffed, they're short of senior staff, they're short of skilled staff that are been trained, that have experience. So
I've heard of this from women in the giving birth, that the people turning up to help them are all new and inexperienced.
Yeah. And I do know a nurse that works in maternity here, again, a new nurse, a couple of years experience, and they've believed the lie that this was really, really bad and this was the answer. I was never afraid of it. I mean, from word go, you just happened to listen to the news reports, which I didn't listen to a lot because I don't watch the news. But I started looking at some of the data very early, and it was like, well, it's an old person's issue, just like the flu. Mm-hmm. So I'm not afraid of the flu. I'm not afraid of COVID. I'm not afraid of other things that I've nursed in my 24 years that have made some people on the ward run for cover somewhere else, and we've just gone, well, we just do our processes, we just get on with the job.
What things are they? Have you dealt with AIDS and stuff?
I have dealt with patients. So I specialised in dialysis. Yeah. So we dealt with blood, and we did have patients that came through occasionally with HIV. Antiretrovirals have done a wonderful job of containing that, but we had a lot more hepatitis B, hepatitis C. Obviously, you had to follow procedures and policy to keep yourself safe. But where does wearing a mask 24/7 work? It doesn't. It's not designed for that, you know.
How did this happen? In your years of nursing, did it just happen just before you left, or has it been a gradual decline of standards?
I think it's been a gradual decline, and potentially, I think it comes from a couple of reasons. I was trained over 24 years ago, and I would have liked to have been a hospital-based trained nurse and get paid for my training, but at that time in Perth there was no option. I had to go to university, and then in university you're taught to be more critical. You're taught to ask questions, which also didn't go down very well when you first started your career. Why are you doing this? What are you doing? I ended up getting into an education swing where I helped people do dialysis, teach them how to do this. And therefore, I suppose that helped me learn. I also had brilliant teachers when I first started. And then I think probably into it, we lost, at the end of the day, if you had to retrain and do a degree, which is going to cost you money and you have a debt, then why would you go back and do nursing? And so I think we went through a stage even when I went up the ladder quite quickly. I was a little bit older than my peers, because I was older when I finished my training. I was 27, 28 rather than 20, 21. But I had fantastic teachers, but a lot of those teachers were coming up to retirement. Or one lady, she was hospital-based, she didn't have the university training, so for her to go up the ladder, she had to get the piece of paper, and then her husband's business was taking off. So she was fantastic. She got me every week and downloaded to me information, skills, it set me up. And then even when I went into dialysis and I specialised in dialysis, I had a couple of nurses that were pioneers in the field and such brilliant teachers. And I learn hands-on, and then I think I did the same thing. I passed on the knowledge that I learnt. But I think in that swing, you've lost people that haven't got the ability to teach. If you're an academic, you will fly through university. I struggled with university. I
still saw you.
Great one, photobomb. So I think in that, and I think then it's a generational thing. The younger generations come out and they want to be in charge of the ward, and they think they should be in charge of the ward because I've been to university and I'm smarter than you.
Can I ask, what interested you in dialysis?
Ironically, it was purely, I finished my training. I wanted to be a paediatric nurse, actually, when I got into nursing. I went to the Perth Princess Margaret Paediatric Hospital for my first placement, and it was awful. I hated it. The nurses, paediatric nurses have a tradition of eating students alive, and that's what they did. They treated us terribly. And I could stand up for myself because I was a little older, but it was all very intimidating and awful. The parents of the children were great. It's the processes. They were just so unwelcoming, so unhelpful. Wow. So then I was like, oh, crap, what am I going to do? I can't be a paediatric nurse because I'm not working here. And I was like, right, I'll just got to finish my course. I'll just finish my degree. I did a graduate program, and that my fate was sealed because I did a 6-month surgical rotation. That was urology. And my medical rotation was actually renal, nephrology, and actually, ironically, respiratory. So it was a medical placement / surgical, because on the ward for renal, we did transplantation. So we nursed kidney transplant patients. All the patients that needed access for their treatment of dialysis, whether peritoneal or hemodialysis, would come for access. And then because our patients were often diabetics, unwell, we did a lot of surgery on the ward and a lot of surgical nursing because the surgical wards didn't want our dirty patients because our patients have a lot of bacteria, MRSAs, VREs. They've had a lot of antibiotics, so they get a lot of resistance.
Did you enjoy the surgery and seeing the new kidneys going?
It was really interesting, and I did. I loved all of it.
Do they start working straight away?
Some do, some don't. So it depends. It depends on the kidneys are the last organ to come out of a cadaver, of a donor, and it depends on their lag time. It depends on how long they were in ICU and on some of the drugs that they use to keep them alive. Like, it depends on the situation. We did have one young Aboriginal guy years ago, Michael, God bless him. He had his transplant and it just never seemed to work. And then he was on dialysis within, a couple of weeks, back on dialysis. And then about 3-4 month mark, he started coming in and he was always under his weight. So when people have dialysis, one of the things that dialysis does, or two of the things, is basically we remove excess water because they don't wee as much or they don't wee at all, and we remove waste products. So you could tell from his bloods that his kidney wasn't working, so he had waste products and he wasn't passing urine. And then he was coming into treatment and his weight was lower, so he was losing weight. So each time, but you could see he wasn't retaining water. And then, I don't know, he started getting cramps really early on, and we finally ran some bloods on him on his next treatment, and his kidney function was actually slowly improving. Oh, wow. So he had a very late kidney kick in. It was fantastic.
So it finally kicked in?
Yeah, it was brilliant. Yeah, one of the rare, and then the other thing about kidney failure is anti-rejection drugs are nephrotoxic. So they can actually cause your kidney to fail in the long term.
Oh.
Yes.
Oh, so your kidney transplant, you might need another one further down the line.
Yeah, and depending on the cause of your kidney disease, some of the autoimmune diseases, I knew a young 17-year-old who her doctor had told her straight up, you'll get a transplant because you're young, and she did, and she had the right blood type, and didn't have lots of antibodies. So the other thing that happens is that when you've had a transplant, you get all these antibodies. So then getting them the next match after that one fails is problematic. So none of her family were a match for her because they always look at that first. So she had dialysis for a little while. Ideally, we try to do preemptive transplants because they have a better outcome. The kidney lasts longer. So, but she got a transplant, and I remember her telling me, I was putting her on one day, so you get to know them and chat, and she said, oh yeah, the doctor said, if I get 10 to 15 years out of my kidney, that'll be a good run. And over the years, then I've met people in my 20-something years that, they'd come back on and they'd say, I said, oh, you're ex-transplant. Yeah. I said, how long for? Oh, 12 years. Oh, that's a good run. He goes, I hate it when nurses say that. And it's true, but that's unfortunate because if the cause of their kidney disease, and then depending on how much anti-rejection medication they need to get that immunosuppression that's just right to keep the body not attacking the kidney, that can cause their kidney failure.
Now, you've got all this knowledge and all this passion. I can see you love it.
I love it.
How frustrating is it to be working in a cafe because the government is just being, an ass?
It's really hard. It's still upsetting because, I know the system's bad. I know the system's broken. But I was always a patient advocate. Now, maybe not when I first started, but when you see poor medical choices and you see that people count and people matter, then I found my voice to stand up for my patients and go, I don't think this is the best for them. Or, you know what, we're 2020 and you can't get them pain relief, help the kid, So for me, I believe I would still be a patient advocate. Whether I would be bashing my head against a brick wall and how long I could do that for, I'm not sure. But
so this is the Hippocratic Oath that nurses sign up to too.
Yeah, that's exactly right. Do no harm. I met some ladies this morning and we're talking about Novavax, and I did look at Novavax as an option, but then my husband cynically but wise, he said, Ange, they've bought all this Pfizer, you're not going to get Novavax. It's not going to come out in time. And by the time it was allowed, there's no point. I've already lost my job. I've lost my career.
And also, do you need it?
No, well, I didn't think I needed it. But maybe I would have. If it come out earlier, I may have taken it to keep my job.
For your health or to keep your job?
To keep my job, yeah. But I was
Don't you think that's something about that's everyone's taking for granted, but it's distasteful?
Oh, it's evil.
You're not taking for your health, you're taking it to keep your job.
It's evil. Because at the end of the day, and the thing that I say to people all the time, because you still meet people that have had their doses for whatever reason, a lot of them are fear-based. Most of the staff I worked with got it to keep their jobs, to keep a roof over their heads and their kids' heads. I mean, that in itself is wrong. I wasn't afraid. I'm not in the risk group. So why do I need to take an experimental medication?
Especially now with all the evidence coming out now from Twitter, and it's constantly coming out.
Oh, yeah.
Even Pfizer has admitted it doesn't stop transmission.
Yeah, that's exactly right. And I watched an interview the other day, I can't remember the Australian immunologist's name, with Dr. Campbell. And he said this vaccine works systemically. Coronaviruses are localised to your mucous membrane. It was never going to work. And obviously we know from the Pfizer leaks and stuff that they knew it wasn't going to work.
Well, everybody knows, but the government's pushing it today. 5 jabs today, they're still pushing it.
I know. And they've still mandated for all the New South Wales Health that they have their booster. I actually don't know of anywhere that hasn't mandated the booster. I've been looking,
If they stopped it, would you go back?
I would. I would go back to nursing tomorrow. Yeah, I would. I don't know whether I would last a distance, but I'd need to try.
Would you be willing to travel? Like if one of the other states dropped their mandates, would you consider moving?
Potentially. I think about this a lot. But, I love where I live. We've empty nested now. I've got 3 stepchildren. One of them has moved back to Port. The other 2 have moved to Newcastle. And I suppose with everything that we've been through, with all the lockdowns, I'm from Perth, so I was locked out of Perth seeing my mother. She had cancer. So I got there for 4 months or just under, luckily, to be with her and care for her. It makes you a little bit cautious about moving away, because you just seeing everything that's happened, it makes me a little anxious, cautious, that I don't want to be too far, because if something happens, I want to be able to get to them or they can get to us, So I have thought about it. I've even toyed with the idea of going and working in England, because they dropped the mandates for their healthcare workers. I've got family there, I could do it, but it's, I felt like I love Port Macquarie. We were in Perth for a couple of years working, and then we moved back. So, it's that whole, I don't know. It's something I think about all the time.
How does our society benefit from having you work in a cafe rather than doing your job?
I don't know. I give really good service. Yeah. I care about people. I don't know. I don't understand that. I don't get it. And in fact, one of my ex-bosses walked in and I saw her. And she looked at me, and the first words out of her mouth, it's a shame that someone with your experience is working here. But they're still working in the system. They're not fighting for us. Can
I ask, how have you changed from before you ever heard of COVID to now? Good or bad?
I would say the change is bad. Because I'm still living with the effects, like, we have a mortgage. We've been supporting kids through school. How do people make ends meet when you're working in a cafe? It's affected everything. It's affected my purpose. I had such a sense of purpose doing my job.
I can tell.
I loved my job. I loved being in nursing. I thought I would nurse until I retired. I really did. My goal in life actually used to be I want to work part-time because I can then work a couple of days and keep my brain stimulated and make a difference and help people. I suppose now we just need to look for different ways to make a difference.